Imagine violence as a disease that affects 1 billion children globally each year, that is not only treatable but also preventable. So we have very promising interventions that show how to prevent violence against children, and we need to act on it now. Violence was ranked as the second leading cause of death in young people, especially males, in all regions of the world. And for some regions, for example the Americas, it's the leading cause of death in young people. And beyond causing high mortality in young people and many years of life lost, violence also leads to severe injuries, including disability. It is related to a range of mental health problems, and it's also associated with non-communicable diseases. For example, cancer, cardiovascular diseases, and diabetes. Many forms of violence are, however, still hidden. Adolescents very rarely report violence to health or social services. And this is particularly true for cases of bullying, for example, or sexual violence. Boys and girls are affected by violence in different ways. So it's very important that we consider differences between genders. Boys, for example, tend to be much more affected when it comes to homicide and death. 84% of all deaths due to homicides are in boys and men, and boys also tend to suffer more frequently physical violence than girls. On the other hand, girls are much more affected by sexual violence. They are 7 times more likely to be affected by sexual violence. So it's very important when we develop interventions that we consider that they target boys and girls, and that we, for example, also consider children with disability who are also at 4 times higher risk of experiencing violence, to make sure everybody benefits from these interventions and nobody is left behind. A sea change is required in the way that we think about violence. So violence needs to be clearly recognized as a public health problem that has huge impact on the health and also the social development of young people. Often the health sector experiences a lot of the consequences of violence. So adolescents coming to hospitals with injuries, disability, but many of the interventions that are needed to prevent violence have to occur in sectors other than the health sector. Some examples for effective interventions are, for example, parenting interventions to prevent child maltreatment in young people, which is one of the major risk factors for youth violence and violence among the adolescents. Another example is life skills interventions that are often administered by the education sector in school settings. There's also changes in norms and values required that are often done in community interventions. Of course, we need to address laws that address violence, but also laws that address risk factors for violence, for example, the harmful use of alcohol. And of course, we mustn't leave out the response services. That includes not only health services for victims of violence, but also social services and justice services.